Ah, good job, girl. You got good normal rotation.
It's not the only thing that's normal, I got
You're not normal, but she's normal.
She said it, not us, right?
You're not. So now let's go into the next assessment. I'm going to teach her what lateral flexion is because she's already compensating. Lateral flexion is when this ear goes straight across to this ear. Does that look normal? That's about 30. That should be 45. Left lateral flexion is when the left ear goes to the left shoulder. Whoa, that's interesting, isn't it? So, are you trying to do it? She's like, okay. So, we have an issue, don't we? So, we have a restricted left lateral flexion with a hard infill. Would you be able to stretch her muscles on the left side? No, because the facet joints are not opening on the right, not closing on the left. So lateral flexion should be 45 right, 45 left, soft in both directions. If it's hard, then you're thinking improper opening, closing of the lateral facet joints. Okay, everybody got that? Now we're going to shoot from the side with the camera. We're going to check flexion and extension. Now, don't show them how normal flexion is performed because most people don't have that anyway. I want you to bring your head forward and flex your neck down towards your sternum. So she's restricted, number one, because it's supposed to be 50. And number two, there's no lift at the occiput. Ideally, what should have happened if she didn't have the forward neck and the jammed C1, C2, ideally what should have happened is the occiput should have lifted and the chin should have tucked before the neck. So not only is it restricted, there's a lot of jamming of the occiput into C1, into C2, which is what's restricting that rotation pattern of the neck. Everybody with me so far? And normal cervical extension should be 75 to 85 when you bring your head and neck back. And she can't do that because in order to do that, she's jamming the stuck open posterior cervical facet. So we've lost good cervical flexion. We have all the motions that are restricted, and most of them are joint related, needing some techniques that will improve joint function. Everybody with me so far? Now, let's say they had whiplash. Dr. Jones sends me a patient, she was in a car accident, and my clinical reasoning and my diagnosis is that she had whiplash, and the literature says cervical sprain strain. What does that mean to you? What's injured if there's a sprain?
Sprain is
Okay, I sprained the ligaments. What do ligaments do?
they hold the muscles together.
Okay, so now you're going to ask questions like, have you had an x-ray? Are there any non-displaced cervical fractures? Is there a subluxation? Is there a hypermobile segment? Because if you loosen up the muscles, what's going to happen to the hypermobile segment? It works. So one of my colleagues who was a chiropractor, he's now in Italy, he's in Rome. He said, as a chiropractor, I had a history of stirring up most unstable segments, SIs, necks, back, spines, spondylolisthesis. He said, I was really struggling as a chiropractor to treat unstable vertebral segments, cervical, thoracic, lumbar, SI. He said, so he went back to be a surgeon, and he developed the prolotherapy, the stem cell injections, and he's a good friend of mine. He took my 5-day intensive class, actually, just to learn some things about what we do. And he said, now he lives in Italy, and that's all he does. People come in for injections of PRP and stem cells for unstable segments, and he's seeing really good benefits. And so when you find a doctor like that, that's who you would refer out for segments that are unstable, that need stability and tonification of muscles and support. But for cervical strain patterns, we can do muscle resistance testing. There are 6 motions available of the neck: flexion, extension, right rotation, left rotation, right and left lateral flexion. So if they have a soft tissue injury, we can do a muscle resistance test and see where that happens to be. However, my 30 years plus years of experience would tell you that most soft tissue injuries, unless it's a major strain, will not surface when you test the neck in a neutral position. But the smaller strains, those levator scapula tears, those scalene tears, those smaller micro tears, those tendinosis conditions will surface when they're under a deeper stretch. So as we go through the treatment and we start to increase ranges of motion, you may have them pull against resistance and you might find some micro tears that need to be treated. But we're going to learn the test in neutral, but we're going to continue to evaluate throughout the treatment. Does that make sense to everybody? So there's 6 motions I'm going to test. One is when you flex your head and neck forward, and I'm going to resist that. And when you pull into my hand, you have any soft tissue pain in the front of your neck. So she doesn't have a significant, everybody do that one. She doesn't have a significant anterior cervical strain pattern, not a significant one. The next test is you're going to go back behind the, let me put these slides up here. Oops, one back. I have 2 hand placements for cervical extension resistance. My favorite is not the one on the second slide, it's right here, where you're on the occiput with the web of your hand. And what you're going to do is, because this will include the suboccipital muscles, so she's going to try to look up and extend the occiput, and then she's going to try to pull her neck back so it engages the upper and lower cervical muscles. So when I resist that and you look up and try to extend the occiput and push back, is there any soft tissue pain between my fingers and C7? Anything?
No.
So there's no soft tissue pain in the muscles that extend the occiput and extend the neck. No strained factors. Significant. Now the next one we're going to do is these muscles over here, they bring the head to the same side shoulder. It's called right lateral flexion. So if I hold above the ear and on the shoulder and you try to bring this ear over to this shoulder, is there any pain that you can touch with one finger on the right side? So she doesn't have a significant, say, levator scapula, anterior scalene, a lot of muscles attached to her that could be injured. But she doesn't have a significant right lateral cervical strain pattern, soft tissue injury. Then go to the opposite side, bring the left ear over to the left shoulder, anything on the left side. So most of her stuff is joint problems, not soft tissue. Created by muscle imbalance. With me so far? Now we'll shoot from the head, 2 more tests, and we'll take a short break, and then we'll be on the table for an hour for treatment. If you want to just shoot from the front for a second. Thank you, sir. Show them what right rotation is. That's when they turn like that, and then come back to neutral. Now, you're going to gently, with 20% of your strength, you're going to try to rotate right, and I'm going to resist that. Go ahead. Any pain when I resist her. So she's got something here. So start thinking about muscles that come up and attach here that have to engage in right rotation like levator and different muscles. So watch again, when I resist right rotation, go ahead and touch where it hurts. She has a minor right lateral cervical strain in here. I'm going to treat that in there. Now let's perform left rotation. Anything on left rotation? So there's nothing on this side. Okay. So a little bit of soft tissue there. How long have we been going since the break? Anybody?
Came back at 10:45. So.
It's 11:30. I have pain, but apparently it's more.
45 minutes? Since we're going to be on the table for about an hour, let's just take a 5-minute restroom break. And then we'll get off the table.